So now we'll talk about the acetylcholinesterase inhibitors. So they are divided into two main categories. They are the reversible ones and the irreversible acetylcholinesterase inhibitors. The reversible acetylcholinesterase inhibitors are edrophonium, neostigmine, physostigmine, and peridostigmine. So mainly N, E, P, neostigmine, edrophonium, physostigmine, and peridostigmine. And the irreversible ones are ecothiophate and nerve gas agents, okay, such as serine, topsoman, tabun, etc. So these are the ones that these are ones that of course are not used clinically generally, because these are mainly used by terrorists and other people who would like to launch terror attacks on other people. So edrophonium. So for edrophonium, which is a reversible, okay, it's a reversible acetylcholinesterase inhibitor. Okay, it's an acetylcholinesterase inhibitor. So just a quick recap. We have the exon terminal here, and so first you have choline with acetyl-CoA, okay, acted upon by the enzyme. Also important to remember the enzyme. Okay, so we have acetylcholine. Okay, we have acetylcholine. So acetylcholine then gets into the synaptic vesicle. Gets into the synaptic vesicle, and then it's released into the synaptic cleft. Once it is in the synaptic cleft, it can either bind to the cholinergic receptor or it will be degraded by acetylcholinesterase. So acetylcholinesterase will break down acetylcholine into choline and acetate. So if you can inhibit this, so you will have more acetylcholine available acting upon the receptor. So you will have a prolonged, a sustained effect of acetylcholine. So this is the acetylcholinesterase, and this is a postsynaptic cell. Okay, so let's go back to edrophonium. So edrophonium is an acetylcholinesterase inhibitor which is reversible, and injecting edrophonium chloride may result in a sudden improvement in muscle strength, which is temporary. Okay, so if you give this drug edrophonium to a patient who has myasthenia gravis, because we know that in myasthenia gravis you have your own antibody acting on the neuromuscular junction. Okay, you have the destruction of the neuromuscular connection, and if this is destroyed, okay, or attacked, you will have problems with contraction, and what these patients will manifest with a few things such as drooping eyelid and also muscle weakness. So if you giving hydrophonium chloride will, if it increases the muscle strength, okay, in a patient, that is an indication that the patient has myasthenia gravis. So hydrophonium, as we know, blocks an enzyme which is acetylcholine esterase that breaks down acetylcholine. Okay, and acetylcholine is the chemical that transmits signal from the nerve endings to the muscle receptor site. Okay, I mean, this is of course, in layman or easier terms. So acetylcholine esterase. So you inhibit the breakdown here, so you have more action on the cholinergic receptor. So anticholinesterase agents can be used for the diagnosis and treatment of myasthenia gravis, and some of them can be used in the treatment of Alzheimer's disease. Alzheimer's disease. And drugs such as tacrine, donepezil, rivastigmine, galantamine, these are all drugs used to treat Alzheimer's disease. So, however, these drugs are associated with adverse gastrointestinal symptoms because of the excess in the acetylcholine activity. So, excessive acetylcholine activity So you have excessive acetylcholine activity because of the inhibition here, okay, inhibition of the acetylcholine esterase. So excess of that will cause certain side effects, of course. So these drugs, the ones that inhibit this action, can be used sometimes to, it can be used to diagnose myasthenia gravis, an autoimmune condition causing muscle weakness. Okay. So autoimmune means it's your immune system attacking your own system, okay, your own body. So that's for myasthenia gravis, hydrophonium, and then we have drugs such as donepezil, rivastigmine, galantamine, which are used to treat Alzheimer's disease, which we know that Alzheimer's disease manifests as dementia, okay, mainly senility. So they are senile. Patients with Alzheimer's, they are usually senile. So there are many types of many causes of dementia. Okay, this is just a quick recap of dementia. So we have vascular dementia, usually due to stroke, okay, due to a hemorrhage or an infarction or a blockage in one of the arteries of the brain. Okay, we have mixed form, and then we have dementia with Lewy bodies. We have Parkinson's dementia. So this is which is part of the Parkinson's disease. And then we have frontotemporal dementia, okay. And then the main bulk, okay, about 60% or so are caused by Alzheimer's disease. So this is the main cause of dementia, the main cause of senility. Okay, I think that's all for now. We will continue in our next episode. Thank you for listening.